When should naloxone be administered? Naloxone is a short-acting drug used to counteract the effects of an opioid overdose. Anyone who displays signs of an opiate overdose may administer naloxone through nasal spray or injection. Naloxone treatment needs immediate medical assistance to avoid significant opioid withdrawal symptoms. Naloxone is a life-saving medicine for patients who are in danger of dying from an opioid overdose. Anyone who uses opioids, whether recreational or otherwise, is in danger of overdosing. Having naloxone on hand does not encourage dangerous drug use, but it does mean that someone overdosing has a higher chance of surviving and eventually receiving the care they require. It's not yet too late to seek help. If you or someone you know is addicted to opioids or has the potential to overdose, we have the required care and treatment. Our helpline is 24/7 available. Contact us now. Does someone you love suffer from drug addiction? Don't wait until it's too late. Call our 24/7 helpline at 1-800-570-2259. A caring addiction specialist is awaiting your call.